Hi, everybody. Hi, I'm Lisa Folda. I'm the Assistant Director of the Public Health Studies Program. For anybody I haven't met yet, welcome. So glad you're here. You obviously didn't bring enough friends. We have a little extra room, but I'm thrilled to welcome our group that's here today, and I'm really glad that y'all made the time to come, because I do think that having all four of these representatives in one place is really useful to your process and deciding about these important next steps, really looking at some of the comparisons and what makes each program distinctive, and thinking about how that serves your needs and what is going to be a good fit for you. So I'm not going to hold the microphone for long. We are going to try to videotape this and put it on our website after the fact, so if you need a refresher, they're going to put up some stats and some details up here. We hope to have that for you on the website, at least the slides, hopefully the audio as well. And you're certainly welcome to direct other people to that too if they weren't able to make it tonight. So without further ado, I'm going to let Vincent and Naomi and Lauren take the stage. Stacy, I understand, is going to join us in just a little bit, but I will turn it over to you.
Good afternoon. Welcome. Thank you again for coming, and thank you for hosting the event. Unfortunately, Stacy will not be here. We'll actually be speaking on her behalf. There is stuff there from Yale on the table. For folks that have just come in, please feel free to grab stuff now. You're more than welcome to grab it now. We're going to be showing a video that will last about 5 or so minutes. Then we'll get going with our presentation. This is going to be a little interactive. What were some of the pointers the video was talking about with regards to public health? What was it promoting? Don't everyone speak at once. Yes?
Education.
Education. 2 more things at least. 2 more.
Seatbelt.
Seat belts.
Policy, I guess.
Policy issues, yes. healthy choices, no smoking. It was basically following a person from birth as they were progressing into school, marriage, and then having a child. It's a complete cycle. Can you all hear me in the back at this level? I just want to make sure it's working. Okay. So public health is a wide range of things. In fact, this is one of the, what is public health now? How many of you are majoring in public health? This is kind of redundant, so I'll be zipping along to these slides since a lot of you are public health majors. But I'll just add to what you see here. One of the things on our building at Harvard, on the side of the building, is in different languages. It says the highest attainable standard of health is one of the fundamental rights of every human being. So all 4 of our institutions live it, breathe it, faculty, staff, and students. That's sort of the bottom line of what public health is all about. And there is a difference between that and medicine. They actually complement each other. Folks that be thinking about medicine, we actually have a combined MD and PH program that all of our institutions have, and you'll hear about that more as well. And it touches all of our lives, as the video was giving it, from nutrition to exercise, from birth to senior citizen. It just covers all aspects. Look at the Baltimore Sun, you get the Washington Post down the street on 95, there's lots of things about public health, usually in the first couple of pages. So now we're going to talk a little bit about our respective schools, starting with Columbia.
Yeah, so how many of you to start have been to New York City before? All right, almost all of you, wonderful. So Columbia, as you may already know, is located in New York City. We're actually located on the Medical Center campus, which is in Washington Heights at 168th Street. So maybe a little farther north in Manhattan than some of you have been. We started as a school of public health in 1922, and our current student enrollment is a little over 1,400 students.
And if you continue on Interstate 95, you'll eventually hit Boston, which is where we are located. Anyone been to Boston? Okay, okay, I was going to say. I was supposed to be dead silent, but that's okay. Great, well that's where we are. When you think of Harvard, you think of Cambridge probably, but we're actually located in the medical area in Boston, along with the med school and dental medicine. We're one of the older schools of public health. We were actually joined with MIT back in 1913. We spun off in 1922. We're one of the larger schools of public health, and actually our enrollment is approaching 1,100.
Okay, just take a poll. Who's been to Hopkins before? Okay, good. All right, great. How many people have actually been to the School of Public Health, though? Okay, and probably seniors are taking some classes there too. How many seniors do we have in there? Okay, great. So, so as you're kind of walking through this, the building right now, I'm sure you've seen 100 years. We're very proud of that right now. So we are celebrating our 100th anniversary. We were established in 1916, so we're continuing the celebration this year. Just take 33rd Street and just keep on going. And you can reach our campus. You can take the shuttle to. If anyone hasn't been there, I'm always happy to offer some tours or connect you to some faculty as well. So, we are one of the largest schools of public health. We have about over 2,000 students that are currently enrolled in the program.
And Yale sends their regrets. They weren't able to join us, but they're located in New Haven, which is right between New York and Boston, so you have to go see them if you're heading up to see us. They're also one of the older schools of public health, but they're also one of the smaller schools of public health with 300. So we're going to zip through this since a lot of you are public health majors. How many first-year students are here? First year, second year, third year? Okay. So public health, these are the core areas of study. If you go to any accredited school or program of public health, you will be taking classes in all 5 of those areas. But as you know, public health is much broader than that. You can do global health, you can do nutrition, infectious diseases. There's a wide range of what public health is all about. And the next slide actually goes into the departments that each of our 4 institutions offer. And again, I'm sure you're familiar with a lot of the nomenclature that's up there. The takeaway from this, as a reminder, is that even programs like epidemiology, all 4 of our institutions offer that, but there's a lot more behind that word. Like in Harvard, there are 12 areas of study within the epidemiology area, and I'm sure that's true for all our institutions. So you just can't go by the word that you see. Also, like behavioral sciences is an important core area of study, but it can have different naming conventions. Like with Yale and with us, we call it social and behavioral sciences. At Hopkins, it's
Health, behavior, and society.
and at Columbia.
It's socio-medical sciences.
And there you go. So, you know, just go beyond the word, look at the content in all our information that we provide.
Great, and so as you're starting to think about applying, especially for those that are approaching junior, senior year, we want to keep a couple of things in mind. So we've posted a couple of things here just so you guys can get an idea of what you may want to look for as you're thinking about different institutions and schools of public health. So first, we want to remind you that we do go through an accreditation process just like most all universities do. For schools of public health, we go through SEEF accreditation, making sure that we're providing the best education possible for you. We also want to think about the size of the institution. We gave you a sample of what our 4 institutions look like. So you want to be mindful. You want to know what size classrooms and what size institutions you feel most comfortable in and what makes you thrive in your education, as well as thinking about private versus public and in research centers and affiliations. So all of our institutes have wonderful research centers that are part of our faculty are working in. Students get to work in as a research assistant. That's a great opportunity as a student. So if that's something you're looking for, you want to kind of see what might be available in the different institutes that you're looking for, because you're all going to be in a variety of interests. That's the beauty of public health, that there's going to be a wide range of research opportunities. So you want to make sure you're choosing the right institute that will provide the right resources for you. We always like to remind you, if you've seen one school, you've seen one school. I'm sure going back to just thinking just a couple of years ago when you were thinking about where you were going to study for your undergraduate studies, all of the schools look very different and have different feels to them and offer different opportunities. So we always say, if you've seen one school, you've seen one school, so definitely do your research. We do have an application process. So we are all through SOPHIS, which is the common application. We'll be talking about that in just a little bit. But we want to, again, kind of keep in mind a couple of things that all of our schools do require. So first is the statement of purpose and objectives. So that's going to be your window of opportunity to kind of explain to us what kind of drew you to public health, what you've been studying, what you're interested in still studying, skills that you're missing, things like that. Maybe professors you want to work with, or just areas you want to study further, what you eventually want to do in public health. Those are just some topics that you can touch upon. Also, the letters of recommendation. That's another way for the review committees to get to know you as an applicant. Particularly for the master's programs, there's no interview process, so that's going to be our way to really get a chance to know who you are as not only a student, but as a person, how you can contribute to the work that's going on in public health. Also, official transcripts. We're going to need them from Hopkins as well as any other undergraduate institutions you've attended. Additionally, experience is also something that we look at. So that can be anything from internships, summer programs you've done, things you've done on campus, off campus. We'll be talking in a moment about experience and some of the programs that require specific experience throughout either during your undergraduate program or post-undergraduate, as well as standardized test scores. Most of our programs do require some sort of test score. Typically it's the GRE. We did provide some pamphlets and information, and also available on our websites about which scores are or which exams are accepted for the various programs. One thing I do want to mention also is we do take a holistic approach. So we are going to be looking at all of the aspects of the application. So we're going to be taking into consideration your GRE scores as well as your GPA, and looking at your GPA and kind of seeing how you transition throughout the 4 years or 5 years of your program. And then kind of taking all of that and really seeing who you are as a student and as a contributor in public health.
So we're going to go into a few specifics about our respective schools. I'm going to talk about Yale briefly. The Yale program actually promotes mostly their master's program. Their PhD, thank you. Their PhD is administered out of the graduate school, so for the material that you're seeing on the table that you picked up with you, it's really focusing on the master's program. They listed the deadline dates. We'll talk about the application process. It's very similar across all the different programs. They do accept the GRE as well as other programs. And if you get a little bit of the view book, it provides an overall summary. On their website, they actually have a detailed description of the offerings they have at the master's level and at the doctoral level. And then I think on the back of that view book for Yale, you will have contact information if you have any questions regarding that.
And then at Hopkins, we have several different programs that you can choose from. So we have currently about 9 different master's programs. To break it down a little bit for you guys, I know some of you may be familiar with some of the programs, but for the professional programs, we have the MPH, which is one of our largest degree programs at the school. It's about a cohort of about 200 full-time students. It does require 2 years of public health experience. We have a couple of combined programs or dual programs such as the MPH MSW, MPH MBA, and a couple of others that do not require the 2 years of public health experience because they're a little bit longer programs. So that year requirement will be waived. We also have a couple of other more professional oriented programs, including the MSPH as well as an MHA and MPP. So the MSPH and the MHA do have an internship component to it, which is really nice. So if you're looking for some additional experience after you've been in the undergraduate program, depending on the program that you're in, it can be anywhere between about 4 months to about 9 months, and sometimes can include a paid internship experience. The full program is 2 years, but the internship is about 4 to 9 months. And then we have a couple of more research-oriented master's programs, including the MHS and the SCM. So those are, again, if you're looking to go more research out, certainly the MSPH can get you there as well, but if you're looking to go into a PhD afterwards, a lot of times students will choose the MHS or the SCM, and sometimes the MHS will filter into the SCM as well, depending on the department that you're in. And then finally, we have the PhD, which is in all of our departments. It's about roughly a 4.5-year degree program, as well as the DRPH. The DRPH has recently transitioned to what we call a school-wide program. So it's going to be on a more part-time basis. So for those that are looking for more of a are in the workforce, it does require 3 years of public health experience as well as an MPH. So just some things to take into consideration as you're thinking about the next steps in your public health career. And then also I did want to mention we have a couple of new degree programs that are exclusively online. We have a master's in spatial analysis as well as a master's in public health biology. So those are 2 new programs that we're introducing this year, and I'm happy to discuss both of those programs as well as our others later. I also wanted to mention we do have several deadlines, so if you look at about page 60 of the pamphlet that I handed out today, you will see that. It's also, again, available on our website. I do encourage people to make sure that they are mindful to the deadlines because most of them are, after December, but just to make sure you keep everything in line for when you're applying. And then, as I had mentioned, we are through SOFIS now, so that's a new thing. We were only through the MPH program, but now all of our programs are through SOFIS. And then test scores do vary by program, so again on about page 59, and again on our website you can find out that information about the different requirements for the particular programs. As far as experience, the only programs that have a required experience are the MPH program, which requires the 2 years of public health experience, as well as the DRPH, which requires the 3 years of public health experience, as well as a MPH or an equivalent degree. All of our other programs have suggestions. The doctoral program does suggest that you have some experience as well as a master's, but there are some times that students are eligible for those programs without those requirements. So,
I know I need this, that's why I'm forced to project. So you'll see a little insert in the brochure that was handed out that summarizes our degree offerings. And I'm just going to go into a slight detail about it because when we were doing our work, we wanted to simplify the degree offerings for our schools. So the first thing that's listed is our Master of Public Health, which is a very popular program. In the past, we used to require a prior graduate degree. That's no longer the case, and now it's just based on experience. So we have the MPH 65 that's listed there on the right, and that requires just 2 years of post-baccalaureate full-time experience. That's a 1.5 year program. Then we have the MPH 45, which is a 1 year program that requires just 5 years actually of work experience or a prior graduate degree. We also have joint programs that are listed there. So a new one that's offered is a joint program with the design schools. We have a master's in urban planning along with the MPH. That's a new offering. The application for that is starting this year for the first cohort next year. So I wanted to call your attention to that. We also, on the Master of Science side, that's more on the research, more on the academic side of things. We have the SM2, or the 80 credit Master of Science. That you can go straight into that program from high school, from college. You all look like high school students. Is that how I say that? You look so young. Anyway, also we have the 1 year program, the 1 year 42.5 credit program that does require an MD or a PhD background. On the doctoral side of things, we have the DRPH, which is a professional doctoral program. It's 3 years, generally looking for at least 4 years of prior work experience or like an MPH going to that role. And we also have the PhD, which is an academic research track. But I want to call your attention to the Population Health Sciences PhD, which actually comes in 5 different flavors, which are, there used to be 5 different departments, and so if you're interested in global health or behavioral science, that's the particular PhD you would select. All the degree programs are offered through SOFAST except for the PhD. You have to apply to the Grad School of Arts and Sciences for that. Another change for us from prior years is our application deadline day has been moved up. It used to be December 15th forever. Now it's December 1st. Made it a little bit earlier so we can get the notices out to you or the decisions out to you sooner. So when you think Thanksgiving, think about our deadline day at the same time so you can get those 2 things out of the way. So earlier deadline date, we are, as I mentioned, a SOFAST school for all our degree programs except for PhD. The GRE is our preferred test. We'll accept other exams if you completed the degree that required it. So we'll take the JD if you're a lawyer, et cetera, et cetera, et cetera. And with regards to experience, as I mentioned, the MPH does require minimum 2 years of experience. The SM2 does not. Any math majors in the room? Those biostatistics, that's the way to go for math majors. You can apply your math skills in a very hands-on way, and there's a lot of great job opportunities along those lines, which you'll hear about that as well.
Okay, and last but not least, Columbia's programs. So our largest program is the MPH, the Masters of Public Health. We offer that in a 2-year program, and with the 2-year MPH, all students complete the same core curriculum. They choose a department to focus their sort of major coursework in, and they also choose a certificate. The certificate can either be for advanced training in a specific area, like advanced epidemiology, or the certificate can be used to really diversify your skill set and get something else of interest to you. So for example, global health or sexual and reproductive health. Also with the 2-year MPH program, all students complete a practicum requirement, which can either be research or a field placement, but it's a really great opportunity to get some hands-on experience while you're in the graduate program. So with the MPH, we offer that through 6 academic departments, and all of them will accept students straight from undergrad, except for our Population and Family Health department, which does require 2 years of postgraduate full-time paid working experience. So it's just something to keep in mind as you're looking at the departments that we offer. We also offer an MHA degree, which is a Master's of Healthcare Administration. You can really think about that as being a business school education in the context of the healthcare industry. So a lot of students from that program go into things like healthcare consulting or really working for hospitals and healthcare organizations, improving the business processes from the back end. And with the MHA, we offer that full-time, which requires no postgraduate work experience. We also offer it part-time if you want to work full-time and complete the program. That requires 1 year of healthcare-related experience. And we also offer an executive program, which requires 7+ years of healthcare-related experience. We also offer an accelerated MPH degree, which can be done from a few different ways. So either you need an MD or JD, or a master's plus 5 years experience, or you can enter into the accelerated MPH through one of our dual degree programs. So we offer 10 different dual degrees. So if you're interested in something like business school or law school, or even urban planning, you can, you don't have to choose between public health and that other degree. You can really do them combined. So if you have questions about a specific dual degree, feel free to come up afterwards and ask me any questions. The accelerated MPH is essentially the same as our 2-year MPH, minus the certificate coursework that I was mentioning, and so that program is completed within 1 calendar year. We also offer Master of Science degrees, which are really going to be more research focused. So we offer those in biostatistics, epidemiology, environmental health sciences, and socio-medical sciences. So those are great if you're either hoping to become a researcher or you're hoping to build a research portfolio to later apply to doctoral programs. We also offer doctoral programs. So we have both PhD and DRPH programs in a variety of our different academic departments. So again, if you have specific questions about one of the doctoral programs, feel free to come up and ask me afterwards. Most of our PhDs, just due to the competitive nature, really only accept students with master's degrees, but it is possible if you have sort of a wealth of public health research experience from undergrad, that you could enter a PhD straight from undergrad. So our deadline is December 1st for all of our programs, so just keep that in mind, same deadline as Harvard. And we are also using the SOFAS application, so very similar process. We accept the GRE as our preferred exam, but we'll also take the GMAT, the LSAT, DAT, or the MCAT if you've already taken one of those exams. And now we're going to move into experience. So as you kind of noticed, each of our schools talk about varying levels of experience. So one thing to keep in mind is that you really want to make sure that as you're applying to schools, you check each of those requirements because population and family health at Columbia may require experience, but perhaps at Harvard it doesn't. So you really want to do your research on each program at each institution to make sure that the programs you're applying to, you're actually eligible for. But when we say that we prefer experience, oftentimes we only think of paid working experience, but really from the admissions committee standpoint, there's a lot of different ways that you can get experience. And really the idea behind this is, what experience led you to know that you want to pursue a degree in public health? Whatever that experience was, we want to know about it in your application. So some things that you may not think to include. Work experience is the first one up there. So definitely on your resume, you're going to have any paid work experience that you've done. But you may not think to put unpaid work experience, such as an internship, something like that. We definitely want to know about that if that helps contribute to your interest in public health. Also volunteer experience. Maybe that doesn't fit nicely on your resume or CV, but that's something you can definitely touch upon in your statement of purpose and objectives. Again, really just letting us know maybe you worked at a community health organization and witnessing the health disparities that exist really inspired you to pursue this career in public health. And last but definitely not least, life experience. Oftentimes it's something that happens with yourself or with your family that inspires you to pursue a degree and a career in public health. And so certainly if that's the case, letting us know that story is always helpful in sort of understanding you as a whole applicant. So I would definitely encourage you, if you're comfortable sharing that story with us, to do so that we can really get to know you, the impact that you want to make, and how you came about that idea. So for those of you, especially freshmen, sophomores, juniors, summer internships are another great way to get practical experience while you're still in undergrad. So I know these slides will be made available on the website now. You can also feel free to take a picture or write down some of these names, but these are all great summer opportunities that you can take advantage of at our various institutions.
Have you heard of SOFAS? We just turned 11 years old. We're thrilled. So SOFAS is a common application for schools and programs of public health. We actually have 90 schools and programs using SOFAS as their application. So it serves multiple purposes. Not only is it the front door for the application process where you enter your biographical information, you can enter your coursework and have your recommenders do the recommendations behind the scenes. You can also check out various degree program and offerings that all the different schools and programs have through the search engine that it provides. There's also an events section that lets you know when there's events happening around the country, recruiting events. For example, there's going to be an Idealist Fair in DC later on, and there's also something you'll hear about regarding APHA. So there's a lot of information there on the SOFAST website. If you haven't already done so, it should be one of your bookmarks, because I think you'll find it very useful, especially if you're thinking about applying down the road.
And so obviously something we want to highlight too is what's going to happen after graduation from one of our schools of public health. So we put up here just a few examples of where graduates have gone after they've received a degree at schools of public health. So you'll see a wide range from biostatistician to different types of analysts, also working at a university setting, working in local and nonprofit organizations. We have people that are working as more of a research manager position, the list kind of goes on and on. So really, the nice part about public health is you can really make a wonderful career out of any of the different areas within public health. And so we'd also like to just highlight some areas. This is data that was provided from a survey done from ASPPH, which is our schools of public health organization. So at the top you'll see universities and college. So that can be working at one of maybe the centers that I've kind of mentioned before. Also a large area that students are going into after graduation is healthcare and government. So particularly in our health policy and management areas. And then nonprofit and for-profit work. So that can be a combination of areas, particularly in Baltimore City and in Maryland and the DC area. You're going to see a lot of opportunities in this area as well as the other represented cities. So you'll really have the chance not only during your program but afterwards to really get connected to one of these areas. And then certainly other areas as well. Some students will continue on with their education after a master's or go into postdoc work, so that kind of falls into the other category. And then we just like to give you kind of a sample of different websites that you can maybe reference as you're kind of thinking about, okay, I'm interested in this topic area. What could I possibly do in public health? So these are just some examples of sites that you can go to. And then certainly, Vincent had mentioned APHA, that's our American Public Health Association. So unfortunately it won't be really in the East Coast for a little while, but if you have the opportunity to, next year it's going to be in Atlanta, so not too far away. There's always a free student day on that Wednesday of the APHA conference, so you can get a chance to get to know different schools of public health, learn about different research that's going on. I know Hopkins has a wonderful representation at APHA. And then finally, looking at our career websites certainly is a wonderful way to kind of get connected to see what kind of opportunities there might be. And even after graduation, the nice part about our career offices is that they can help you along the way. And then during the time that you're in the program, they help with mock interviews, they can